I think that there's been a theme through this discussion, and it is really difficult to do. But honestly, you need to go and center joy in your life, really. Like, have a good think about the things that are dragging you down, the things that are not as you wish them to be. And as much as you can, the things that are changeable for you or what needs to change, go and center joy in your life. The world is far too harsh for us to be harsh on ourselves. Go and seek out the pleasure with immediate effect.
And welcome to Menopause Whilst Black, the podcast that is committed to sharing the menopausal stories of Black people, primarily based in the UK. We are in season 7. This is episode 6. And yes, I have a brand new guest for you. I am Karen Arthur. I'm your host. I am a broadcaster, an artist, and a new author. My children's book, Grandma's Locks, drops on the 24th of October. Exciting times. Yeah. It's been a long day for me. It's been a beautiful day, actually. I, first of all, kicked off my author tour, my school's tour, by reading my book, Grandma's Locks, at my grandson's school. And then I trotted along to the cinema at Battersea Power Station. Did you know there was a cinema there in London? Where I met lots of wonderful people doing wonderful things in the menopause space. The founders of Menopause Mandate, and we listened to Mariella Frostrup and Penny Lancaster and a panel of wonderful women. Michelle Griffiths Robinson was there, and Lavina met her, and they were sharing the results of the survey that they had done, which 20,000 women had filled in, talking about menopause and hormone replacement therapy, which is the theme of Menopause Awareness Month, which we are still very much in. And yeah, it was a wonderful morning. And then I met a friend, an artist friend, and we were talking about boundary setting and rest, which is really important. And then I got stuck on trains trying to get back to St. Leonard's before I recorded for my radio show. So I've been doing a lot, but you're not interested in that, are you? You're interested in my next guest. So I'm going to leave you to it. Have a listen, enjoy, and I will see you on the other side. Welcome to Menopause Whilst Black, the podcast. This is series 7, and we are on episode 6. I was trying to work that out before I came on air. And I'm very excited to speak to my next guest. And who am I? I am Karen Arthur. I am an artist and a broadcaster and lots of things in between. So welcome. I am going to read out this bio. It's a long one, but it's a good one. Dr. Annabel Showemimo is a doctor, academic, activist and writer. She is London-based consultant in community, sexual and reproductive health in the NHS and founder of charity the Reproductive Justice Initiative, RJI, formerly Decolonising Contraception, which aims to address health inequities and racial disparities. RJI have been shortlisted for numerous awards, winning Grassroots Organisation of the Year at the 2020 Sexual Health Awards and a National LGBTQ Health Advisor Award in 2022. Annabel won the inaugural award for Health Equity Champion at the Cura H Awards in 2024. Within her speciality, she is interested in tackling gender-based violence and improving access for marginalised groups. Annabel was a regular columnist for Galdem and is a freelance writer for numerous publications, including The Independent and The Guardian. She has also authored several academic publications in leading medical journals, including The Lancet and the British Medical Journal. She's frequently in demand for TV and radio and has appeared on BBC Newsnight, BBC World Service, Sky News, and the Guilty Feminist podcast. She was recently featured in the ITV documentary Our NHS with Dr. Zoe Williams. Annabel is a part-time PhD candidate and Harold Moody Scholar at King's College London, with her research focusing on the experiences of Black women in Britain with fertility control methods. She is a regular lecturer at a number of institutions, including the London School of Hygiene and Tropical Medicine, UCL, and King's College London. Her first book, Divided Racism, Medicine and Decolonising Healthcare, was published by Profile Books' Wellcome Collection in April 2023 and was shortlisted for the Orwell Prize for Political Writing. Welcome, Annabel.
Hi, thank you so much. It's always really weird having to listen to your bio. Thank you for having me.
Oh, it's my absolute pleasure. I've been looking forward to this conversation, not least because, as I was saying to you before we started recording, this season 7, I seem to be speaking to more people, not about their own experience, but about the knowledge that they can impart and what they know about, the medical profession or about menopause and so on and so forth. But before we get into the nitty-gritty, tell us about you. Tell us about yourself. Who are you outside of all your lovely titles?
Yeah, this is such a hard question because I spend so much of my time working. But I think it's so important to me, and I think about a lot of the legacy and what I'd like to leave behind. And I think that centers me. So I'm very much a lover of life. I love experiences. I want to experience as much of life as possible. I'm always out of the house seeking new experiences. So my work kind of reflects that. So I'm clinical, I write, I love going to the theatre, I love traveling, and I just love being around people. Obviously, not all people, but I do love I love having company. And but then also, I suppose, as a writer and somebody that's really politically engaged, I really enjoy solitude sometimes to process my thoughts and what's happening. Yeah, that's a little bit of insight into the mind of me.
That's great. That's great. And what's your heritage? Where are your parents from?
Yeah, so I write about, in Divided, but I've written elsewhere about kind of my family history and background, because I think, again, it helps kind of center me. My family's of Nigerian heritage on both my parents' side, and all that means, but they're Yoruba. And my dad moved to UK when he was 21. I talk about that again in Dividing, his process of being a kind of a junior doctor in the healthcare system and how that's fed into my own work. And my mum's my mum was born here, but also family, a kind of old legation family, and had ties to the UK for several decades before me. So that also feeds into my work as well.
Thank you. And where are you based? And I usually ask this question, how old are you? Whether that's relevant or not, I've read it now, so let's go for it. Where are you based and how old are you?
I think in the context of a menopause podcast, I think it is important, isn't it? So yeah, that's fine. I'm sure people are sometimes a bit coy about their age, but no, I'm not. So I'm 34, and I am currently now I'm London based, and I was born and kind of bred and studied in London, but I've just moved back from the East Midlands, Leicester specifically, which is where I did my medical training. So also, as a Londoner who moved to a smaller city and moved to the Midlands, I'm also really deeply passionate about the fact that we do need to speak about experiences that are more expansive than just London. and how, these issues affect the whole of the UK slightly differently.
I really appreciate you saying that as well. I'm involved in an event, the Black Ballad UK Weekender, which will have passed by the time this comes out. But my point is that, people were saying, well, why is everything in London? And whilst that's not a dig at them at all, it's certainly something to remember that actually London isn't the centre of the universe. And from a UK perspective, we are talking about everybody in the UK, not just the people in the capital. So thank you for mentioning that as well. And Leicester also happens to be where I did a very different degree. I did a performing arts degree. So I do have to miss Leicester.
Yeah, I actually knew that. And the reason is I think we have like a mutual Carol Leeming that I was speaking to, and interviewed me in Leicester for my book, and we were talking about things, and I think you and your and your degree and things. So yeah, a Leicester legend.
Small
But
world.
also, see you at the Black Ballad Weekender, because I am also doing an event on Black women and sexuality and shame. And I have to say that I've written Black Ballad for 7 years, and we did a fantastic event in Birmingham a year ago, and they do try to do stuff outside London. So I've digressed, but yes.
No, that's true. I was aware of that, but yeah, thank you for reminding me. Okay, my dear, we know you're a doctor, a young doctor, young, compared to me. I'm 62. Let's put that in perspective. What led you, like, why medicine?
Yeah, so I think I'll give you the condensed version, but this is so multifaceted, and I'm sure it is for a lot of medics. I've already touched upon one, and this is the thing that comes up really often, that usually for medics, a lot of your family or someone in your family is a medic, which is often a barrier to access for people that fall outside. So I'm very, very conscious of that. My dad's a doctor. I have other doctors in my family. So I obviously saw the life of a doctor growing up, but it wasn't something that I was immediately drawn to necessarily. But my dad loves his job. He's really good at his job, I think. And I did want something that brought that level of satisfaction. But I've always been into more of the arts as well. I did a lot of theatre acting growing up. I studied English at A level, hence the writing. And I kind of wanted something that could combine both. So also, I started to see that there was a way of maybe combining these things. And I had back surgery when I was 14. I had spinal surgery for scoliosis. And I think my experience having surgery, not really knowing what the recovery would be like, it was quite a shock to me. I was only 14. People didn't want to scare me by telling me that I'd need all this rehab and I wouldn't really be able to play sports like netball to my full ability like I could before. So those things were kind of kept from me. So I don't think it was deliberate, but it made me realize how powerful those within the medical profession are in terms of how they shape your journey. And my medical school statement was very much about the power that medical institutions have. I was a bit bold. I started it with this quote that said, "Doctors pour drugs of which they know little into patients of which they know less." At 18, and
that's very bold.
It was a bit nuts of me, but I got a place. I actually got into a bit of a heated discussion with a vascular surgeon on my panel at UCL, but I got the place. So it was a combination of things. And in Divided, I talk about my dad's journey of migrating from Nigeria at the age of 21, because he went to medical school incredibly young, and coming here, starting his house jobs, and what it means to be a migrant working in this national healthcare system and maintaining British people's healthcare, and now me as a product of that entering into this system. So it was many reasons, but a combination of all of the above.
That's really interesting, and there's a part of me that loves that you're continuing your father's legacy and taking it even further, clearly, with the work that you're doing as well. So what is your specialism? Specialism? Why did
Uh,
I do that? Specialism. And how did you choose it?
yeah, so as you mentioned at the start, so I'm a consultant in sexual reproductive health, which is a very small specialty. It became its own specialty in 2010. It's a subspecialty of obstetrics and gynecology in the UK. And I think it's amazing because I don't think anywhere in the world has our specific specialty.
Mm,
Which is a combination essentially of sexual health and gynecology. So
yeah.
I do menopause care, I do contraceptive care, I manage miscarriage, I do terminations of pregnancy. And I think, and I do sexual health, STI related care, and lots of other things under that umbrella, psychosexual health. It's very expansive. And I think the reason that I came to be in this specialty is that throughout medical school, I was really drawn to issues of justice and health inequity. And
Mm,
I was really interested in public health, but I really knew I liked clinical medicine. And it took me quite a long time to find this specialty because it's quite small. So there were
mm,
only 4 training numbers in the UK in my for my cohort,
mhm,
so it was quite niche, but I felt like it combined it was a great combination of being able to do public health, address these health inequalities that occur, but I also thought I'm not afraid to shy away from hard topics. Healthcare is very political, and I I was very happy to engage with those more difficult conversations, like how do we fund reproductive health badly because of the groups that it affects, usually marginalized populations. Termination of pregnancy, a really, a challenging topic for all the wrong reasons. And I was like,
yes.
well, this is a conversation that I can be part of. So yeah, in many ways it chose me, but I think I have traits that made it the right fit for me.
100%. And hmm. So you mentioned justice to do with, why you chose your specialism. And there is a lot of information in your book. I haven't finished it all, but there's a lot of information in your book that has absolutely blown me away and opened my eyes. And for anybody who's listening who didn't hear, the book is called Divided: Racism, Medicine, and How We Need to Decolonize Healthcare. I'm not someone who likes jargon, and I'm not someone who reads medical books at all. But part of my, I suppose, research and my chosen path is around finding out more about menopause. But what I love about your book is that you can just read it. Like you're talking from your personal experience. Jargon is explained if it is, but there are, for me, lots of wow moments at my big age, things that I didn't know about eugenics, I knew that the medical profession is steeped in, racist learnings, but I had no idea of the extent. And I'm still sitting with, as I'm reading the rest of the book, how I feel about that. What led you to write it, and who is it for? Because I assumed it was for doctors. Clearly not.
Thank you so much for taking the time to engage with it and enjoying the read. I think one thing that you picked up on, firstly, that was so important to me is the accessibility. So in terms of who it's for, it was never written to be exclusively for doctors or even those in the medical profession. It is a science read that's accessible for everybody,
Yeah.
and I tried to make it accessible because myself, a lot of people are surprised by this, but I'm dyslexic. I discovered I was dyslexic quite late, but it was quite clear that I was dyslexic. Like I actually learned to read quite late, and I couldn't, like, my
Mhm.
reading and writing wasn't very good until I was about 7. Um,
That's it.
and I it's really important to me that people are able to get this information, particularly around like Black history, but also I try to make Divided quite specific to Black British history because I talk about the US, I talk about a global context, I mentioned Brazil and other places with large Black diaspora populations or Indigenous populations to illustrate the points I'm making. However,
Mm.
as somebody that is of Black British heritage descent, whose family span back decades in this country. I think often there are parts of our history and contributions, and when we talk about empire and that history, that's really difficult to get that information. A lot of it's been deliberately kind of expunged, which I talk about. I have a whole chapter on whitewashing of history and how we perceive achievements, and who established bodies of knowledge, right? And I think it is so important that is made more accessible. So it was supposed to be a read that people found relatively easy, because I use like anecdotes from my own life. I use kind of simpler examples and that kind of thing. So that was really important in terms of the audience. I think language is really important, but then I think we also have to be mindful. So bell hooks, the African American feminist, talked a lot about language being able to be co-opted, right, and how language changes. So I'm not super wedded to language. I said why we need to decolonize healthcare, but I think in terms of what that means to me, I think that's what is important within where we are now. So decolonizing is having so much of a activism resurgence, and for me that's very much looking at how our colonial past has coloured our present, and also how that continues to be utilised when we look at recent anti-racism protests, when we look at the war in Gaza, and whose bodies have historically mattered, and what we do to shape those conversations about mattering, who gets access to healthcare, and I think that this window of opportunity to have this conversation was really important for me to get this conversation moving. So arming people with knowledge at a really important historical time, and that's what I was trying to do with Divided.
Well, you're definitely doing it. You're definitely doing it. And I will also say, if you haven't, people listening, if you haven't read the book, first of all, I urge you to get it, but also to recognize that, I mean, some of the information, when I read Black history, right? When I read Black history and I read about the injustices, or I discover something that I think should be common knowledge, like the fact that Black women start menopause, 8.5 months earlier and up to 2 years, earlier than our white counterparts in the global north, which I thought should be common knowledge. It makes me angry as well. And so I would say, and one of the reasons I'm taking my time with this book is because I'm also processing the fact that I didn't know, and so it's I'm in a sense that makes me so glad that the accessibility part is nailed, because I'm not also running to my dictionary or running to a glossary or do you know what I mean? So I really appreciate you. I'm so happy. And also to say that it was my daughter, Kareem, who alerted me to this book. She put it on her Instagram stories. And then when I commented, she was like, "Mom, you have to read this book." So, and she's also dyslexic. So this was a real, the fact that she was interested in that and was looking into it. And it brought you to me it's a nice full circle moment. So I'm learning a lot. What has been the most, I don't know whether you can answer this, what has been the most eye-opening information you discovered during your research for the book? Or did you know a lot of stuff? Because that's the other thing. I don't want to assume that you didn't know. What kind of blew your mind?
So first of all, can I just say I love a mother-daughter moment. So I love that I can be part of that moment of sharing, and that's really lovely. And in terms of what I knew before, I think when you're researching a non-fiction book, there's so much learning that happens. I came into it, this is my area of interest. I've been interested in kind of race science and eugenics and since midway through my medical degree, which I talk about when I intercalated with medical anthropology. And it's something I've looked at because how it colours the whole medical profession is so substantial. But I think when you start researching for a non-fiction book, you have to start speaking to people. I interview people during the course of the book. I'm reading papers around the subject. I mean, other books in more detail that have been written about it, and you do amass so much more information. So there is lots of learning that occurs, and you're trying to translate that into something that is accessible to the readership. So you condense a lot of it. But I think rather than specific issues or facts being new, it was kind of the overarching idea that despite having a system that's evidence-based medicine, which is essentially the idea that we do large-scale clinical trials, we have like what we call a hierarchy of evidence, and we use that to say that this drug or this treatment is robust, and this is how we determine what we give to patients, and what needs to be built upon, and that kind of thing. When you look historically and you look at this system, there's still a huge amount of unsubstantiated scientific claims that persist, particularly around race in the body, that haven't really been interrogated. So even just like the basic assumption about how we organize our research, that we put people neatly into these race categories, the same race categories that have been created hundreds of years ago, that, you know, you're Caucasian or you're Black African and you're Black Asian, then sometimes, depending on where you're geographically located, people throw in Hispanic, which obviously, as we know, encompasses a whole range of people. And we still research along these lines and use race as like a meaningful category, which we can, you know, deduce how people's bodies operate. And some of these basic principles aren't interrogated. So when I talk about Black birthing people, I talk about how the idea of like the African pelvis is still preserved, that the idea that there is a specific shape to an African pelvis, when we're in a post-human genome era where we know that the genetic diversity on the African continent is more than that of Europe. So how can you have an African pelvis? You know, that encompasses such a wide range of people, right? There is no African pelvis, and how that idea, for example, is so lazy at the best, but it's actually incredibly dangerous. And there's examples. I talk about the case of Delissa Parks, who, you know, unfortunately died through childbirth, and how a doctor, one of the things that was mentioned was that the symptoms she was suffering were because of the shape of her pelvis, because she was a Black woman. And these things crop up, you know, again and again and again, and they just don't mean anything. So I think that's the main overarching thing for me, how we have these unsubstantiated bits of what is perceived as scientific knowledge, but when you drill down, there's no evidence base there, and people just keep on accepting it to be fact.
This is the thing. This is the thing for me around accepting things as fact. We are taught to revere doctors, understandably. There's the white coat syndrome about, you know, well, they know more than us. So it means that when it comes to menopause care or any care, particularly for women, drill it down to Black women, turning up in a doctor's surgery and, you know, talking about your symptoms and being dismissed by a doctor, it's like, well, they know what they're talking about. And so it's almost like we lose our voice. And I think what's important about what you're doing and what you're saying, challenging the status quo and saying, well, for a start, race is a social construct anyway. So if we're starting with that, then we're on a hiding to nothing. But also that we need to be able and be empowered to advocate ourselves by seeing doctors as humans as well. This research is early. Menopause research, is in its early stages for a start. Never mind the nuances of menopause research, but we also need to be empowered to say, you know what, I hear what you're saying, but that's not how I feel, and that's not my experience, and I need you to investigate further, or I need you to refer me to someone who can, you know?
Yeah, I mean...
go on.
No, absolutely. And I think it's something I am constantly almost struggling with. So I think I talk a lot about advocacy, and I started very much this journey looking at kind of issues such as in sexual reproductive health, looking at things like FGM, female genital mutilation, that cohort of patients, and not their voice not being heard, services not being developed for them, and kind of thinking how we do better. But I think also my own experiences, both as a clinician and as a patient, are constantly changing how I feel about what we perceive advocacy to be for marginalized groups, particularly when I talk about Black women. So I recently gave birth to my first child, and I did not have a nice experience. Like so many Black women, I had quite a deeply traumatic experience. And, you know, I've been reflecting, it's all very fresh for me, on, you know, what could I have done better? What could the system have done better? And how do we hold people more accountable? And, you know, we always do talk about us advocating for ourselves. And increasingly, you know, I'm of the opinion that we can do our best to advocate for ourselves, but ultimately, if you're still locked into a system that doesn't see your full humanity, you can't really advocate your way out of that. You can mitigate some level of harm, or you can maybe reduce it, but there's no amount of advocating for yourself that is going to bypass that. And that's not to say that we shouldn't try doing things. It just means that we have to do other things, which are far more complex. Hence some of why I've written this book, because I think a lot of the time people like the low-hanging fruit, the simpler stuff, right? Being able to say, you know, we hired this person that's supposed to kind of, you know, advocate for patients, or we've put on some classes for Black women antenatally, all useful stuff, but is not really going to do the really hard groundwork,
system changing stuff
that takes a long time. Because I think one of the things that Divided showed, and maybe I was not surprised about, but, you know, even reinforced to me, is that, like, this is hundreds and hundreds of years,
100%.
right, of deliberately constructing racial theory that means that people do not matter, right? That people are inferior and do not possess the same level of humanity, are different than, and you can't just, you know, diversity your way out of that, right? That is very hard work.
That's a great phrase. You can't diversity your way out. Absolutely. Absolutely.
You know, it does. I don't want to be bleak, but we just have to be very honest about the system that we're a part of.
This is the thing. It's a difficult one because, well, I just feel sad now. Thanks. No, I mean, I'll just go off and eat my worm pie afterwards. Don't worry about me. No, I think that absolutely what you're saying about we can't diversity our way out of it. And which is why the work that you're doing is so important. And I was going to say to you, is your book on any medical curriculum yet? Like, it needs to be required reading.
So the medical curriculum is such a complicated thing because, you know, I've done work elsewhere in trying to get things onto medical curriculum, and it's very individualized in terms of university to university. There are some things that are kind of mandated, like the British Medical Association, Student Association has this whole document about suggestions that should be on there, but it's so densely packed, and you have 5 and 6 year degrees. It's variable. So there are some medical schools where it's on their reading list as part of a module that they teach, or there's extracts that they mandate some of their students to read. But how much all people teach similar stuff, which I think is the important thing. But it is still so hard to have these conversations because medicine is a degree where people think certain things are fundamental, like, you know, can you read an ECG? Right? Like, you can't exit medical school and not have that core skill, because people like that is a life or death, you know, thing. But then people don't see this information as life-saving, which it is. You know, racism is a public health crisis, right? But it's not perceived of in the same way because you don't get that immediate kind of, people don't see it as immediate cause and effect. I think, we could go and drill down into COVID and what we saw then, because it was brutal. It was brutal for us all to live through, and we're still going to be dealing with those psychological consequences. But I think it was probably the best illustrator about how racism works in healthcare for a lot of people, and maybe got people to open their eyes about why actually teaching some of this is fundamental, which we were really struggling with in that pre-COVID era.
Yeah. And I think that COVID certainly was an eye opener for some. I think one of the many things about COVID and the African diaspora was certainly around the fact that when it came to vaccinations and how somehow the media was telling it felt like the story was, well, you're not having a vaccination, so it's your fault that you're dying in drug. That's like, it was a really twisted gaslighting situation, where I know people who didn't have the vaccination and that's their business, but also around, well, why don't you look into why we're so suspicious of, the government trying to push this vaccination? It's really interested in. I'm glad that your book exists and people are paying attention. I want more people. I hope that more people who can affect change will be paying attention. But I also recognize that this is a system problem. This is not an individual problem. And as important as it is, there's that word advocate, for us to be able to advocate for ourselves as patients. You're absolutely right. We need more. We need more. But I also think it's not about taking things on face value. I know that Miss Karen from 20 years ago, going to the doctors would just, if the doctor says, oh, well, this is wrong with you, you're wrong, then I would just say, oh, okay, then, and just feel bad about it and suffer. Whereas this Karen today, I'm like, well, I don't agree with you. Or this is my experience, or can you refer me to someone else? Or, and I think what I mean by advocate is that I want Black women to find our voice. Kick up stink is my actual phrase.
And I think that is also a fundamental part of changing this kind of this landscape, because we've divided. What I was very much trying to do is empower people with knowledge to say, hang on a minute, okay, what you're saying doesn't make sense, right? Yes. When you say Black people with high blood pressure should take X, right? The evidence around, and saying, okay, to a degree, that's fine, and this might actually do me some good. But also, actually, you guys have huge blind spots in how you perceive of this issue. And that's okay. That doesn't mean that all medicine is bad. That doesn't mean that you shouldn't take your medicine. That doesn't mean that. What it means is that we need to do better. We need to do better research. We need to understand what Blackness is in terms of a social construct versus how it operates in this idea as in like racism and scientifically. So I think advocacy is 100% important. I think I've dedicated so much of my time that if I didn't think it was important, that would be quite depressing. I think what the journey of this book and my own experiences continue to show me is that unfortunately this is going to take a long time, because the situation is much more complicated than I think people allow for it to be, because it is hard to accept that it will take some time.
Yeah. And that it's not necessarily for us now, but it's for future generations. I don't want my children or children's children to have to be banging on about the same bloody thing. That's they're my thoughts on that. I did not write this question down, so I'm going to throw you a curveball because you've answered a lot of my next ones. I want to talk about racial weathering.
Yes.
I tell you why. There's a lot in the news at the moment. There's a lot of fear mongering, scaremongering, but also we know we've got a new government. We're not in the EU. We're not protected. There's several genocides around the world. And we live in a social media age where we're hearing more and more about the far right and people of the African diaspora being immediate danger. And this is the first time in my 150 years on this planet where I've actually felt a little bit more worried than normal. And I am aware that knowledge in itself, even though I am not directly affected, could have, well, let's be optimistic, a detrimental effect on my physical and mental well-being. It already affects my mental well-being, but my physical well-being. What are your thoughts on racial weathering in general, or how we can look after ourselves specifically? That's a big
Yeah,
question.
so I'm glad
But I
you brought this up,
apologise
because
now.
no, it's a big question, but I'm actually really glad that you brought it up, because I was actually going to feed it into an answer for one of the previous questions, and I think I forgot, or maybe we didn't answer that question. So racial weathering, for people that don't know, it's something that I do include in some of my lectures. It's a term that was coined by Professor Arlene Geronimus, who's based in the US, and it's this idea. And in her research, she started off looking particularly at Black African American women, and now has applied that to other marginalized groups. But it's how the stresses in your environment lead to accelerated aging process, and ultimately premature death or increased morbidity in some way. And actually, recently, this term she coined several decades ago, but recently she released a book about weathering as well, which I suggest people go and read: The Extraordinary Stress of Ordinary Life on Unjust Society, or something like that. But it's a great book. Now, I think it's a really important concept for us understanding one of the ways and mechanisms in which forms of oppression, particularly racism, can impact people's health. It can, cause alarm or distress, and maybe even lead to more weathering if you know you're being weathered, as you mentioned, right? In terms of, if you think that facing racial injustice, experiencing these acts is causing you, negative consequences on your health, then that actually psychologically is actually quite, damaging and draining. So, sometimes it's like, okay, we figure out this language to talk about this, but now is that also impacting us negatively? It can be very difficult to decide almost what the best thing to do is. But I believe it's better to know than not know, because then obviously we can do things you mentioned to try to mitigate some of the stresses that we put ourselves under, and how we live our lives. And not all of these things obviously within our control. We can't necessarily account for other people's racism, sexism, or whatever oppression that we're kind of forced to interact with. But we can sometimes construct our lives to maybe center joy and remove some of these other additional stresses, and it's not always possible, because some of us are in circumstances where we do not have very much autonomy whatsoever, and you need to go to that job and you need to interact with that person daily, and that's where people like myself or other people that have the ability to, sound the alarm or try to campaign for better circumstances fit into the mix to try and ease that for people. But I think ultimately, if I look at my own life, and we started off this, conversation talking about who you are, I do a lot of this work, and people say to me, well, are you not worried about the toll that constantly talking about racism and sexism and all of these things is having on your day to day, because this is what you do all of the time? But then when I'm not doing those things, I try to, as much as I can, center joy in my life. And like, what does that look like? I say yes to a lot of things. I'm very frivolous. I should probably pay more attention to like money and things like that. But like, actually seize the day. Life for some people can be short, and I want to see my friends, see my family, have new experiences, and that's how I kind of mitigate the impacts of some things on my life. But for a lot of people, it's not that straightforward, which I appreciate. But I think it's a very important concept for understanding one mechanism of how our health is being impacted, or one theory by all of these oppressive acts that are happening to us.
Yeah. Okay, that makes a lot of sense, and that is very inspirational. And I suppose one of the reasons I wanted to talk to you about racial weathering, because obviously I'm reading your book, but also it's important to me because one of the things that led me to start the podcast was around the fact that, you know, the knowledge around how Black people experience menopause, and also that, you know, racial weathering is a form of stress, and that stress can bring on the onset of menopause. And because there's no research anywhere about that connection, I was interested in how we were looking after ourselves. And I've noticed recently, from a personal point of view, that it's something I worry about. And maybe that's because I'm aging. Maybe it's because I'm older than a lot of my counterparts. And I've been struggling with, you know, that cycle of, well, if I worry about racial weathering, then that's adding stress to my life, which means that I'm being racially weathered, if that's a phrase. And so your advice around seeking joy, and also not being guilty to share that joy. I spend a lot of time far too much time on Instacrack, and I have a joyful feed, but I'm also very conscious of being honest about, well, actually, this didn't happen today, and I don't feel like this today, and that kind of thing. But there is a little, you know, about how can you be joyful when the world is so shite?
You know, absolutely. And it's really hard because we're in difficult times. And but there are a few things. And one of the things that I think I touched upon in Divided as well is the act of the colonized mind, and what racism does to the mind. And I touch upon the work on draw on the work of Frantz Fanon, and Black Skin, White Masks, and psychologically that impact that has on you. And one of the powers of where we've got to with racism is that you don't really need to have like individual acts, in terms of people don't need to confront you with a racist you know, sentence or say a slur. It's a structure that means that you're constantly like hyper vigilant. So you go into a shop, you're worried that somebody's looking at you because you might be shoplifting, because that's happened to you so many times before that, right? And this kind of feeds into that, right? You don't need to the work has already been done on your mind by the oppressor. You know, you're worried about these cycles of weathering and the impacts that this is happening on you, and it stops you from experiencing joy, you know. And I think I also find that I have to keep going back to that, right? I have to make sure that I'm not doing the work of an oppressive system as well, you know. In terms of the liberation, for me, is very much in shutting some of those thought processes. It's very difficult to do sometimes down, and that's why people say that Black joy is so liberating, right? Because within all of this, right, within all of what we face on a day-to-day basis, and being told that you're lesser, that actually it's an incredibly difficult but incredibly liberating act to say, I am a happy, centered person that's going to go out there and live my life regardless of you. And you know, that is what I try to get to, despite everything. I would encourage people to do, right? So when you read books like mine, when you read about weathering, you can feel really heavy, but you need to not do that to yourself.
Yeah. But I clearly needed to talk to you today, Annabel, because I have been struggling. I know lots of other people are as well. I know it's not just me, and that's really important that intentional seeking of joy and looking for the glimmers and finding. I mean, I talk about where you're happy and the you know, the connections between conscious fashion choices and your mood, but sometimes I don't always preach that. I mean, I don't always practice that because sometimes it's hard. So I
It
appreciate
is
you
hard.
mentioning.
It is
Yeah.
hard. And I will just say that, I have not got it all sewn up. As I said, I was pregnant up until a couple of months ago, and we're living in very difficult times. I found it very difficult with what's happening in Gaza to,
Mm,
navigate
mm.
pregnancy when I was looking at children going through different,
Gosh.
going through things. And it was, it's very difficult to just say, oh, I'm going to look at all the things bad that happen in the world, but choose joy. Like that is a very opposing concept. So we'll have times where it's just not possible or plausible. But I
Mm.
think as much as we can, I think it's important that we push back against what some of this apparatus is set up to do to you mentally.
Thank you. Thank you. Mic drop. Annabel, what's the most fulfilling part of your chosen path?
Um, so I think the most fulfilling part actually is I think the individual encounters that I have. So I think this is a wonderful kind of spin-off to what we're discussing, because when you're dealing with macro level stuff, you're looking at overarching systems, you see all of this, doom and gloom everywhere. There's racism, there's this imperialism. You're like, oh my God, what do I do with all of this?
Mm. Mm.
Um, those individual counters I have, either at events or clinical settings where it's just you and a patient, and they go well, because not all my clinical encounters obviously go well, I'm human. But the patient or the person says, your book or this thing really helped me, or this encounter has really changed how I feel about my condition, or I really got all the information I need today. I'm like, okay, I've really made a difference to that person's trajectory, their health experience, maybe even their life,
Mm.
and for me, it's really lovely to have a job where I can get that satisfaction. Um, Maybe not every day, because every day is different, but I can get it almost on a weekly basis. And I think that's probably the most fulfilling bit of my work, or maybe, yeah, bit of my work, really.
Yeah, I love that. I love that. And how fortunate you are to be able to get that from your chosen career. It's beautiful. But yeah, you are doing wonderful things. So big up yourself. You talked a little bit about um, people saying to you, "Oh my God, you research racism. Don't you get depressed?" All that kind of stuff. And you talked a little bit about how you care for yourself by centering joy as much as you can. Who else or what else has supported you?
Yeah, so I think, first of all, I'm going to say I'm really blessed. And I have, friends and people that I'm around that haven't necessarily got a good unchosen family, right?
Mm,
So
mm.
we're all just, it's a roll of a dice which family we end up in. And I'm really lucky that I have a really supportive, structured family that can help me in terms of they can come over, like my brother's downstairs helping me with childcare,
Oh,
and I have that that around me. And I think that we know that makes a huge difference. And for those
mm,
that don't have it, some people really blessed with a chosen family, and not everybody has the ability or has got a good chosen family as well. But I do. I have, a great partner that's always supporting me as well. And I think those things enable me to do the things that I do. So I'm very much the product of a village.
oh, I love that.
If I didn't have good people around me, I'm very aware that a lot of the things that I'm able to do, would not be possible.
Yeah,
And so it is quite important to me to try to also, as much as I can, and I do work a lot and things like that, but I do try, hopefully they agree, but can't always do it, but feed back into those people, because it's also like I think it's a bit of a circle. They
yeah,
feed and nourish me, and I try to feed and nourish the people around me with positivity, because otherwise I can't really do
yeah.
all these things that I'm doing.
I love that. That's beautiful. And the village is so important. It's something I've moved from London to the coast where I hardly knew anybody. And I'm so used to doing things on my own. It's been empowering to be reminded by others that I'm not on my own. And so, yeah, we can't do this alone. We don't move alone. We move much faster with people. And I'm really glad that you are surrounded by people you love and people who support you. That's so, so important. And it also sounds like you bring a lot of joy as well. So, yeah, I love that. I love that. How do you celebrate yourself?
So I think this is something I actually, I probably actually could be better at, because I do think that when something good happens for me, I generally have so much going on, I do tend to move on to the next thing, right?
Mm,
So sometimes I look back, like, for example, the last 12 months of my life, and I'm like, wow, you accomplished so much. But then I don't maybe take the time on one of those accomplishments to like really take it all in, celebrate
yeah,
that individual achievement. So I can actually be better. I think that when something good happens, or when I do want to celebrate, I do try to spend time with my loved ones and my family, and that's how I celebrate. As
great.
I said, I moved from the Midlands recently. I wasn't seeing people as regularly, so taking that time to be able to see people was really nice.
Good stuff. Now, I know the answer to this, but you're going to tell the world, or the people who are listening to this certainly, which tune instantly makes you want to dance?
Yeah, so it's a bit of a random one, but it's probably City High. What would you do, for people that know that song, know that album? I was quite young actually. We established when it
Mm,
came out. I think I was like 11. But I think that album plus Writings on the Wall by Destiny's Child, they have like
okay.
messages in them. And I was quite conscious of the lyrics of songs when I was younger, and them actually being motivational or insightful. And that song, it's catchy, but it also had like this, some of it wasn't great, but like a message. And I loved
Yeah.
that kind of music.
It's so funny because I can see the album now. I remember I rinsed that album when it came out. I was a lot older than
I
you,
did.
which is why I laughed when you told me before we started recording. But I am absolutely going to go and listen to the after this podcast because,
It's a
yeah,
good one.
and it's going to go on our season 7 Spotify playlist. So I might put the whole album on. You never know. Final
Yeah, you love
question.
it.
Final question, Annabel. Gosh. What's the one piece of advice you would give to any Black woman listening to us now?
I think that there's been a theme through this discussion, and it is really difficult to do. But honestly, you need to go and center joy in your life, really.
Mm,
Like,
mm.
have a good think about the things that are dragging you down, the things that are not as you wish them to be. And as much as you can, the things that are changeable for you, or what needs to change, go and center joy in your life. The world is far too harsh for us to be harsh on ourselves. Go and seek out the pleasure with like immediate effect. Yeah.
Honestly, you are one wise human. I want to thank you for giving me your precious time, especially as you are, a young mother, and all the things that you do on top of that. It's been brilliant, absolutely brilliant talking to you. Anybody listening, go and buy this book. I will put link in the show notes. If anybody wants to contact you, how and have a chat, do you want them to, and how?
Yeah, no, I love people reaching out to me. Sometimes at the moment I'm on mat leave, so I can be a bit slow, but I generally get back to people. I have a website which is literally just www.annabelshowmemo.com. There is a contact page that goes to my inbox. So yeah, you can drop me a message there. And it's also got all the links to my social media as well. So I'm on Instagram, X, TikTok, but I can be a little bit inconsistent on some of them. But generally IG and X on them, I'm okay-ish. So yeah, get at me, and thank you so much for having me. It's been a really, really great conversation.
Yay, yay. Thank you so much. Yay. I'm very happy.
Thank you.
If you have not read or purchased Dr. Annabel's book, please go and do so. It's absolutely brilliant. It won an award. Can't remember the award, but it was very recent and it is very well deserved. What I said in the podcast when I was talking to Annabel is that what I love about it is that it's accessible. I'm not a big fan of medical books. Wasn't a big fan of science at school. And this is a book that not only talks about the history of medicine and colonialism and how that has affected how doctors treat us and how they see this research, but also she speaks and writes in such an accessible way. I know I said this, but I want to repeat this. And I honestly feel that not only should every doctor read it, but I feel that it's a book that needs to go far and wide. So Divided, why we need to decolonize healthcare, is in the shops. I'll put a link in the show notes. Please go and get it. I've been thinking about this Menopause Awareness Month. There's been a lot going on. The media love to pitch people in this space, women against each other in particular. And there is a lot of talk around hormone replacement therapy, different types of menopause care. And I will repeat and I will say that what's really important is that you are able to understand what works for you. Don't let anybody sway you into doing something that you don't want to do. If you feel that an avenue of care isn't right for you, if you feel that your doctor isn't listening to you, if a friend is saying to you, you should try doing, I don't know, a certain thing and you've tried it and it doesn't work for you, that's absolutely fine. Please don't let the media and the fear mongering and what comes across like arguments, don't let that frighten you. If you are worried, it's always important to speak to a health professional. And if you feel that that particular person isn't listening to you, as hard a slog as it might be, do try and get somebody else's opinion, because this is a marathon, not a sprint. And getting a handle on your own menopause care can take some time. I wish you lots of luck. And I always say, talk to people, talk to your friends, speak to people at work. Make sure that you have a support network that is also helping you, because you are definitely not alone. Yeah, that's what I wanted to say. Are there any menopause events in your area? How are you celebrating Menopause Awareness Month, or has it completely passed you by? Are you in a workplace that has acknowledged it? What's going on? And while I'm at it, how's Black History Month for you? How's that going? I have thoughts about Black History Month. The more and more, every year that goes by, more and more people I'm speaking to are saying, you know what? I'm Black every month. I think we're beyond the token celebrating Diversity Month. I feel like it's time that we recognise that not only do we matter, but it's important to not just wait until Black History Month to acknowledge the contribution that we give to the world. But I guess I would love to know how Black History Month is treating you. And I hope that you are able to set boundaries in place if needs be, and also able to rest. Talking of rest, the doors to the Joy Retreat Barbados are well and truly open. I will be taking 10 Black women to Barbados next year with me from the 28th of April to the 5th of May, and I would love for you to join us. Go to my website, menopausewhilstblack.com, and you can find out lots more about how you can join us. There is a 3-month payment plan as well. And there are 8 spaces left. So yeah, come, have a read. If you feel that spending a week with 10 like-minded women, black women. That bit's important, in a safe space with people who understand you. We do yoga, we do journaling, we learn to meditate. I work with 2 wonderful facilitators, and I'm really excited to have a new cohort join us in 2025. And if you would like to find out more, just drop me an email at hello@menopausewhilstblack.com, and I will send you more information. Or, as I said, pop to my brand new website. I'd love to hear what you think about it. It's very colourful and vibrant, just like me and the clothes I wear. And we'll take it from there. I sound tired because I am tired. It's later than I would like to be, but I thought it was important to speak to you. And also, I'm excited to hear what you think of this episode. If you love season 7, if you love season 6, there are 5 more seasons. If you haven't caught up, do catch up. But more importantly, keep talking about this podcast. Keep sharing these episodes in your WhatsApp groups, on your various platforms, word of mouth, at work, wherever you're hanging out, so that we can really reach the ears that need to hear us and to hear these conversations. That's me. Don't forget to look after yourself. Be gentle with yourself. Drink your water. Wear your SPF. And I'll speak to you soon. All right. Take care. Bye.